afternoon, everyone joining us. I appreciate you taking the time to be here. As Rachel said, my name is Ian Still. I live in Grain Valley, Missouri, outside of Kansas City. Proud to be here supporting Benefitbay, which is an ICRA administration platform based in Kansas City, Missouri, as well. We're going to dive into what ICRA is and how Benefitbay is leading the race and the charge here for ICRA expansion across the United States, but more specifically in our rural Missouri healthcare communities. So with that, we're going to go ahead and jump in. So ICRA for Missouri, what is ICRA? ICRA is the Individual Coverage Health Reimbursement Arrangement. To me, it's an untapped resource for improving access to care in our rural communities. Some quick information oversight about Benefitbay. We were founded in 2021. Again, our headquarters are right here in Kansas City, Missouri. This is a recent picture we did at our company offsite that was here local last month in March. Although we had people flying from all over the world to attend the event, it was a great time, as always, to connect with our coworkers and our team around the country and around the world to make sure we're all on the same page. So, Benefitbay, we are recognized as a best-in-class leading SaaS platform for ICRA administration. We are bold. We are not just a SaaS company. We are, as we like to consider ourselves, the ICRA standard due to our technical and operational focus, best-in-class customer service and engineering teams. We also have the most advanced payment infrastructure in the ICRA industry, which we will cover here in a few minutes. And by the way, if anybody has any questions live during this presentation, please feel free to throw them in the chat. And myself, Rachel, Kevin, and I will get to them as soon as we can. A little bit more about Benefitbay. So we are a SOC 2 HIPAA high trust compliant agency. Our advanced reimbursement checking or our ARC accounts are tracked, managed, and visible to all stakeholders, including insurance agents, employers, HR, and employees alike. And again, just covering our personalized high touch support. We have dedicated licensed enrollment staff members available to help assist any insurance agent, employer, or employee along the way throughout their ICRA or enrollment experience. So I want to bring something to everyone's attention here. Last month in March of 2025, Benefitbay, our technology team, released what we call the ICRA Direct Integration Standard Report, or the IDI. And what this does is it sets a new standard for enrollment security and workflows when it comes to individual health insurance carriers across the individual ACA market. If anyone has more, or if you have questions or would like more information on this IDI report, please feel free to, again, just drop something in the chat or send us an email. We'd be happy to provide a copy of that report or just more information. All right, so what is the Individual Coverage Health Reimbursement Arrangement, or ICRA? So it was first available for use beginning in January 2020. And what it did is it allowed employers to provide a new benefit option where they're basically funding the premiums for ACA qualified health plans on the individual market versus enrolling their company and their employees in a traditional group plan. This entails and allows the employees to have more benefit options as far as their plan choices. They can go browse the individual market and select a bronze, silver, gold, or platinum plan based on their family's budget or their needs. Again, as an alternative to traditional group health insurance, where they might be limited to one carrier with maybe just a small handful of plans. ICRA also is compatible with businesses, or excuse me, for businesses of all sizes, from a two-person mom and pop shop to multi-state large-scale enterprises. ICRA offers budget control, allowing employers to define exact monthly contribution rates and therefore helping avoid unpredictable group renewal rates or sticker shock that come. I know a lot of folks are seeing those renewal rates come in this time of year, and they're up against steady renewals of 20, 30, even 40% increases. Touching on the scalability again, it provides the opportunities for small or geographically spread out teams to now be covered under this new type of benefit approach. And then again, it of course expands personal choice to employees across any state, allowing them to exit the legacy group market while still offering or being offered a competitive benefit with those personalized, individualized choices. So focusing on our home state here in Missouri, where does ICRA provide the most value? If you look at this premium rate map from our partners over at IDEON. It shows states that are favorable for ICRA and individual rates in green. And as you can see, Missouri is what I like to call glowing in green with premium savings. And I have highlighted here a specific county in rural Missouri, Texas County, where you can see that individual plans are significantly less expensive when compared to small group or group policy coverage. This is for a 50-year-old individual being offered a gold level plan, still less expensive by $260 per month, again, compared to group coverage. So if you take that, you multiply that by 10, 20, or 100 employees, you can see the cost savings is potentially significant for employees, especially there in these counties that are highlighted in green. So, how does ICRA help rural Missouri? Again, it enhances our state ACA provider networks while offering employers more predictable costs and greater control over your benefit strategy. As ICRA strengthens and states gain the ability to reinvest locally, they're, now treating their individual coverage markets and networks not as just the backup, but as the new standard for employee benefit options. More quick facts here. So ICRA mitigates adverse selection by encouraging a more diverse set of individuals or employees to enroll in state-based ACA plans. It supports long-term coverage participation. Since the policy is actually owned by the employee, the individual coverage potentially stays with them even post-benefit. If they were to leave or be let go from their company, provided the ICRA, they can still keep that plan with them and then therefore are more likely to stay insured after employment year over year. As you know, strength is in numbers. ACA insurance carriers are really diving in and investing in ICRA and individual policies, specifically with the off exchange market. They're incentivized now to offer more competitive rates and more attractive plan options thanks to programs like ICRA. And this in turn leads to increased insured patient volumes for providers. The affordability creates new opportunities for businesses in rural or underserved areas to offer new health insurance options for their workforce. So again, looking at how ICRA helps our neighbors here in rural Missouri, I want to call out this specific map from our partners over with Ambetter. Ambetter has a specific ICRA-friendly insurance plan through their solutions network that, as you can see here, offers coverage in almost every single county in our state. Again, these are exclusive off exchange individual plans that Ambetter is invested in to make sure that folks in these rural areas do have access to care and affordable coverage through ICRA programs. Just a quick comparison here from this solutions network map over to this illustration of Missouri. As you can see, the red indicates our most high risk, unhealthy populations, specifically in the southeastern corridor of Missouri. It looks like there's been several hospital closures. This is from the Missouri Rural Health Association here, highlighting the hospital closures in yellow, green, and purple. And we can see here that again, Ambetter companies like Ambetter offer coverage in all of these counties. So essentially, these folks here would be able to enroll in a qualified ACA health plan. Looking at some of the continued barriers from the Missouri Rural Health Association's assessment report, we can see that insurance coverage was highlighted as one of the biggest needs for economic stability. And again, if you look at the incentives and premium decreases from ICRA and on the individual market combined with the expansive networks that we have offering coverage, ICRA really is the solution for sustainable healthcare options in Missouri, especially in our rural and again underserved areas. Touching on the needs assessment again, just wanted to focus real quickly on the this part in particular, the telehealth and connectivity. You know, plans like Ambetter offers through their solutions network often come with virtual care, often available 24/7 for any of their members. So with ICRA adoption and more enrollments on the individual network, this would hopefully reduce these barriers and access to care by creating, a better platform and stronger coverage for folks to access virtual and care in those rural communities. All right, so who does ICRA help support? ICRA offers a new, more affordable benefit option for startups, nonprofits, and rural employers who may not otherwise qualify for group or level funded health insurance plans. one of the greatest things about the Affordable Care Act is that it eliminates um, underwriting, and those people who may have pre-existing conditions are able to enroll with no discrimination. So ICHRA sidesteps the complex medical underwriting and renewal shock often tied to self-funded group plans. More quick facts here just about ICHRA and the fixed monthly contribution. So employers can gain total control over their benefit budget without the risk of claim uncertainty. It provides a new path forward, a scalable benefit option without the financial exposure of self-funding. It provides plan flexibility for Missouri patients by increasing policy choices for individuals, encouraging them to stay in network with preferred providers. And then, of course, access to care, our number one priority in rural or underserved areas of Missouri. ICHRA gives small employers a new way to offer coverage, increasing the number of insured patients accessing these local medical practices.
I do have a question here in the chat real quick.
Yeah.
So with ICRA, do employees have on exchange plan coverage with premium tax credit subsidies or only off exchange plans with no government subsidy?
So with an ICRA, if the employee is offered affordable coverage, they cannot take the subsidy. The IRS would consider what we call double dipping. As long as the benefit again was considered affordable, they would not be able to take any subsidies. Instead, the assistance would be coming from the employer or their company, which provides the benefit tax free to the employer. I hope that answers the question. We can certainly dive more into details later at the end.
Thank you.
Yeah. So looking more at who ICRA helps support. So Missouri is uniquely positioned right now to support our underserved rural communities with greater flexibility and access to care through ICRA. Again, just looking at this solutions network map from Ambetter with the total Missouri poverty rate, we can see here again that these underserved communities that are lacking resources really have the option now and availability to offer an affordable, more attractive health benefit program as coverage is available to through almost any county throughout the state. All right, so why ICRA? Well, through individualized health plan choices, rural Missouri employees are no longer limited to the legacy insurance policies that companies may have formerly offered through group health insurance plans. This makes it ideal for employers with employees spread out across multiple states, maybe working remotely, as individual plans often vary by location in terms of network selection and prices. So if there are any agents on here or employers who are considering ICRA, here's just a few key points to consider: that ICRA does satisfy the ACA mandate an, for employers to offer affordable coverage. Again, it offers greater choice for employees so they can find any ACA plan that fits their family's needs and budgets. It's tax advantage, so contributions can be tax free for both employers and employees. And then employee classing, which we're going to get into here in a second. This is one of the best parts, in my opinion, about ICRA is the ability to set defined contributions based on the employee's geographic location, again, allowing the employer to accommodate specific premium differences that they might see from state to state or even county to county. All right, so we're going to dive in a little bit to the Benefitbay platform now and go over ICRA classing and how to basically, well, classify these individual employees across your workforce. So here's just a quick screenshot. And as you'll notice, I'm using this demo account. We have the Show Me Healthcare set up as our demo agency, with the Missouri Honey Association being our demo employer here. But the point being is I wanted to show that employers, HR professionals, everyone has access and full visibility to their employees' participation, which includes their enrollment status and payment statuses. This is another example here of the employer itself offering coverage to eligible employees through our employee management portal. So, through the employee management piece, agents and employers can easily add or remove employees and create new special enrollment periods for new hires or folks who have a QLE or a qualifying life event. This is an example of one of those enrollment periods here, again, allowing all stakeholders easy access and visibility to these enrollment statuses and progress for the employees. So Just an example here, you have 23 total employees who are eligible, 21 haven't taken action. So I know that's a concern a lot of times with HR and administrators trying to get their employees engaged and making sure that everyone is tracked and gets across the line for those new open enrollment periods. And we'll touch a little bit on our client success teams and how Benefit Bay is here to provide support. But again, just wanted to highlight here that all stakeholders have access to these types of reports and tracking progress with their employees enrolling in qualified coverage. All right, getting into ICHRA employee classing. So employers can segment their workforce by employee classes such as geographic medical rating areas, MRAs, or other tailored health benefits to individual classes, which we'll cover here in just a second. So in all, there are 10 total classes offered through ICHRA. The top five that we see most often here at Benefit Bay are full-time, a class based on a specific geographic location or medical rating area, a class specific to salaried versus hourly employees, and then seasonal employees. There are a few rules to setting up ICHRA classes, such as, well, they must be clearly defined and consistently applied across the board. And then some classes may require a minimum size specifically for ALEs to avoid discrimination. I just wanted to call out here and highlight some of our classing features. This shows here under the employee management how with the benefit based system, you have different classes that are set up for the specific employer. So using the Missouri Honey Association as the example, we see here we have a few different classes. One is the main office headquarters, that would be by geographic location. We have this class set up here for full-time employees, and then another example of a part-time class. Okay, so touching on the geographic locations or medical rating areas, Missouri has 10 different medical rating areas that are based on counties. I just want to call out and give thanks to the Missouri Hospital Association here for the graphic. If you are not familiar with MRAs, it basically created a rule that each state will have a set number of geographic rating areas that ensures that all issuers in the state must uniformly use as part of their rate setting. So these are essentially what define the premium rates for health insurance plans across the state. Again, Missouri has 10 in total. And then when you're looking at employee classing and enrolling different individuals through the benefit based system, once you have entered an employee's address, we will pull up their specific rating area to their location. So just using this as an example here, we see this individual in Kirksville is listed in Missouri rating area number 2. And I did a little screenshot example here too of the employee health plan search. When the employee themselves are searching based on their specific rating area, they will be able to see what plan networks or plan types are available in their area. Are the plans HSA eligible? And then through Benefit Bay exclusively, we list out which networks are actually offered per insurance company. You're not going to find that feature through any other ICHRA TPA platform at the moment. Question we get a lot of times is ICHRA compatible with group coverage? Yes, you can offer ICHRA alongside a group plan as long as the policy is not being offered to both classes. It can only be offered to specific classes. You can't offer to both at the same time. And there are specific rules, minimum class size requirements that vary by employer. Again, if you guys have any specific questions or situations you would like us to look at more closely, please just send us an email afterwards and we'd be happy to take a look at your situation. But here's just a brief overview of the minimum class size requirements that vary by employer. Any questions? Kind of breezing through this, but just wanted to pause and make sure before we get into the employee health plan search. All right. So one of the greatest features about the benefit based system here is the employee health plan search. Employees have the option and ability to add as many medical providers as they currently see through their health plan search, and they're able to filter out the plans that are actually in network with their different providers. So here, using this example, Jerry Andrews from our Missouri Honey Association, we have Jerry and a spouse set up. As you can see down here, Sarah and Jerry have listed this nurse practitioner in Kirksville as their primary provider. And through the employee plan search, you would be able to verify whether or not those specific plans from Ambetter or Anthem, whichever carriers are in the area, accept this provider through that insurance network. So not only can you provide your PCP information, but you can also list specific healthcare clinic locations or specialists as well. Again, a very unique feature to the benefit-based system, being able to validate providers based on their provider ID with health plans through our health plan search. Here again is just a little example of what the employees see when they log into their Benefit Bay portal and they're looking for a new health insurance plan. We will list all of the available carriers that are offering off exchange policies in their respective area, including their networks and plan types. Again, is it HSA eligible? We will list the specific networks, the exact offerings and names per insurance companies. And then they can always filter by one or the other, or if they want to sift down and only look for bronze plans versus silver and gold, we have easy filtering options and capabilities there. Also important to highlight that we have license enrollment available agents for every employee via chat, or if they'd like to set up call, we're always available to help assist. So this is an example of a completed health plan enrollment that your employees would see once they finished their plan selection. As you can see here for Jerry, they selected a plan with Anthem. This shows their total biweekly cost as the employer. They can scroll down, and I've kind of chopped and cropped the image here, but further down in the plan details, they can always click to access and download their summary of benefits for their specific plan. If there's a prescription formulary, that's available to view or download as well. And they can always see their total ICRA monthly contribution from their employer down here, and then the monthly total premium amount for their plan. Those who are listed as participant and all of the plan details here are tracked in the individual's employee profile. And again, all stakeholders have access to this for uh, the HR administrators all the way up to the insurance agent or broker for that specific company. All right, kind of diving into that piece now for employer coverage reports and payroll. So employers can track enrollment progress for all of their employees. We looked at this a second ago, but just wanted to highlight some of the few other status reports that are indicated. So we have total employees, those who have not started, those who are currently in the shopping process. Pending means the application has been captured but not submitted yet. Employees do all receive an email once the application has been submitted and our enrollment team has verified that their coverage is effectuated. Employers, agents alike have the ability to send emails out to their workforce just to send a welcome email to get them engaged and started with the process. More of some of the payroll and coverage reports that are available for the agents and employers. Active some coverage summary report, see who's enrolled, see who has canceled, and see who has waived through this report here. Payroll deduction reports are always up to date based on a company's payroll cycle, whether that's monthly, biweekly, whatever the case. You can see the total amount of deductions that are required to fund the ICRA. And then the reimbursement schedule again just lines out the individual contribution rates for each eligible participating class. We have dedicated client success teams always involved with every employer as well if anybody ever had any questions or needed assistance with these specific reports. Touching on some of the other reporting capabilities and offerings through Benefit Bay, 1095 reporting is powered by our partners over at Equifax, and Cobra administration can be offered in house as well by our client success teams. I know that Cobra is traditionally a headache, very expensive and time consuming for those involved in the group insurance market. So with ICRA, we're happy to help with Cobra and next steps there if anybody is Cobra eligible through this type of employee benefit. I see we have a question here too from Sylvia. Is the employee paying the original monthly premium price to the carrier and then getting reimbursed the ICRA allowance? So, with our advanced reimbursement checking process, the employer actually funds and fronts the total premium. Let's say you allotted $1,000 for the employee's health plan and it costs them $1,200. That 1,200 would be initially funded again by the company, and then the employee would make up that $200 difference over biweekly payroll deductions or a once monthly deduction, just depending upon how the company's payroll program and cycle works. That's specific again with Benefit Bay. It will depend on the ICRA TPA specifically and how those reimbursements work. But with our platform specifically, the employees enroll, the employers fund the premiums. The employees themselves are never actually submitting or facilitating any payments to the carrier. That's all handled in house by our team and administrative work on the back end here. I hope that helps answer the question, Sylvia. Okay, last but certainly not least, our ICRA modeling for defining contributions is done through our amazing feature that is called Fulcrum. Over here for the Missouri Honey Association, I wanted to call out. So this is a plan comparison for the group's current group insurance policy versus what they would be looking at with ICRA. So as we can see here, their renewal is over $30,000 as to where ICRA is just under 20, so a savings of $10,000 right off the bat, and that does include monthly service and platform fees for Benefit Bay and the servicing agent. But all of these proposals and instant illustrations are available through our feature called Fulcrum, where you can. I'm going to just go ahead and jump over to this next slide here where you can actually set a specific benchmark. So if you wanted to offer 100% funding towards a gold low, a gold high, a bronze low plan, whatever the case may be, you can actually designate those different contribution amounts based on a plan benchmark and then define the contributions or increase by 20%, 10%, go back and forth rather easily through our software. And then scrolling back to this, print out custom proposals for your clients to show them these savings and then the offerings through ICRA. So just one last piece here to touch on the employee management. You can easily manage rosters and benefit eligible employees through the Benefit Bay ICRA administration. So you can see here just under the employee management, this is just a simple screenshot of two folks, but you'd be able to, again, add, remove any employees based on their eligibility and the requirements for your employees benefit program. So I know I kind of sped through that. I have a lot of material